Okay, I'm going to be demonstrating how to do a TB injection, or a MANTU. So I would start by gathering my supplies, gathering my medicine. I would do my 6 medication rights. While I'm doing that, I would do my 3-way check, verify that I've got the right medicine, right dose, right patient, time, route, everything like that. So after I've gathered my supplies, I'm going to knock on my patient's door, introduce myself. Hi, I'm Sarah. I'm going to be your nurse. We're going to be giving you a TB test. Is this a good time? I would then verify my patient by asking them their name, date of birth, checking it against their wrist bar or their MAR. And then I would again check my medicine and my patient. So then I would perform hand hygiene. While I'm doing this, I can ask my patient if they have any questions at all and answer their questions. And I would then put on my gloves. And while doing this, I would raise my patient's bed to working level and provide privacy if they had a roommate, whatnot. So I am going to take my syringe, and this is the TB syringe of 1 milliliter. And dispose of this in the wastebasket. And while I'm doing this, I want to make sure that the working surface is clean and clear, the patient's bedside table or whatever. And then with an alcohol swab, I'm going to cleanse the top of the vial. And then I'm going to prepare my syringe. This top I want to leave facing up, or I could leave it on its side and do the swoop method. I'm going to use that later. I'm going to inject 0.1 milliliter of air into my syringe. And then with this, I am going to inject the air into the vial. I want to do this so that I can equalize the pressure inside the vial. And now I'm ready to pull 0.1 milliliters of the medicine into the vial. There's 0.1 milliliter. And now I'm going to carefully cap my syringe, leave that on the clean and clear surface, and I'm going to prep my patient's injection site. And for a MANTU test, I'm going to inject it on the inside arm of my patient. I want to make sure that I'm avoiding any bruising, swelling, tattoos, freckles, anything like that, or veins. So in a circular motion, I'm going to cleanse my patient's skin. And then I'm going to let it dry. While I'm letting the skin dry, I'm going to look at my needle, make sure that the bevel is up. And then I'm just going to, for this, I want to pull the skin taut. After the skin is dry, I've pulled the skin taut. And then I'm going at this at almost a horizontal angle. I want the bevel just to go right under the skin. I don't want it too deep. I want to kind of be able to still see the outline of my needle. And then I'm going to inject the medicine, pull out at the same degree, same angle. Immediately, I want to cap my safety lock on. I'll discard of this in the sharps container. And then that's it. I would gather my supplies, take off my gloves, perform hand hygiene. And then it is now that I would ask my patient if they need anything else. Lower the bed, lock the bed, provide or pull the curtain, double check, make sure they don't need anything, and then I would go document.